Magnesium plays a role in more than 300 vital processes in the human body, from muscle function to nerve communication and heart rhythm regulation. Yet studies reveal something shocking. Up to 80% of people aren't getting enough of this essential mineral. Now, that's already concerning. But what worries me even more is that while magnesium can be incredibly beneficial when used correctly, taking it the wrong way can actually be harmful. Over the years, I've reviewed countless medical reports and seen too many people make dangerous but completely preventable mistakes. Some take magnesium when they shouldn't. Others combine it with medications that cause risky interactions. And these aren't minor side effects we're talking about. Mistakes like these can lead to kidney damage, breathing problems, and even heart complications. So, in today's video on Health 365 Day, I'm going to walk you through everything you need to know about magnesium, the benefits, the risks, and how to take it safely. By the end, you'll know who should take magnesium, who should avoid it, the right dosage, and what signs to watch for. Let's get started. Do you really need a magnesium supplement? A lot of people start taking magnesium simply because they heard it's good for you. But the truth is, not everyone needs it, and some people might even harm themselves by taking too much. So let's talk about the clear signs your body might be asking for more magnesium. 1. Muscle cramps and twitching. Have you ever been lying in bed, almost asleep, when suddenly your calf muscle tightens in a painful cramp? Or maybe your eyelid won't stop twitching no matter what you do. Those could be early warning signs of magnesium deficiency. You see, magnesium acts as a natural calming agent for your nerves and muscles. When you don't get enough, your nerves become overactive, like electrical wires that won't switch off. This leads to twitching, spasms, and cramps, especially in your legs or hands. It's not just about cramps though. Magnesium is critical for energy production in your muscle cells. Without it, your muscles literally can't access the energy they need. That is why some people notice their legs feeling weak or their endurance dropping, even if they're re-eating well. 2. Stress and emotional imbalance. Here's something many people don't realize. Stress drains your magnesium. When you're under stress, your body switches into fight or flight mode, releasing hormones like cortisol and adrenaline. These hormones cause your kidneys to flush magnesium out through your urine, just when your body needs it most. So the more stressed you are, the more magnesium you lose. And the less magnesium you have, the more anxious and restless you become. It's a vicious circle. If you often feel anxious, easily irritated, or struggle to fall asleep because your mind won't stop racing, magnesium could be a missing link in your stress management. 3. Older adults and absorption issues. As we age, our digestive system changes. Your stomach produces less acid, and your intestines absorb nutrients less efficiently. Even if you're eating healthy, less magnesium from your food actually makes it into your bloodstream. To make matters worse, many seniors naturally eat fewer magnesium-rich foods, like leafy greens, nuts, seeds, and whole grains, because they're harder to chew or digest. This combination of reduced intake and poor absorption makes magnesium deficiency very common among people over 60. If you also deal with digestive issues like acid reflux, IBS, or inflammatory bowel disease, you're at an even higher risk because these conditions interfere with nutrient absorption. 4. Medication side effects. Certain common medications can quietly deplete your magnesium. If you're taking diuretics, often prescribed for high blood pressure or heart failure, they make you urinate more, and with that, you're flushing out magnesium. The same goes for acid-blocking medications like omeprazole or esomeprazole. These drugs lower stomach acid, which your body needs to dissolve and absorb magnesium properly. Over time, even if you're eating magnesium-rich foods, your body might not be getting enough from them. 5. People with diabetes. If you have diabetes, especially type 2, magnesium is even more critical. When your blood sugar is high, your kidneys work overtime to remove the extra glucose, and magnesium gets excreted right along with it. Plus, when insulin moves sugar into your cells, it also draws magnesium with it, temporarily lowering your blood magnesium levels. That means low magnesium can actually make blood sugar harder to control, creating a frustrating cycle. However, there's a big warning here. If you have diabetic kidney disease, you need to be careful. Damaged kidneys can't remove excess magnesium efficiently, and supplementing could make things worse. Always check with your doctor before taking magnesium in that case. 6. Alcohol and sweating. If you drink alcohol regularly, Even just socially, magnesium loss can creep up on you. Alcohol reduces magnesium absorption and increases how much you lose through urine. Over time, this can lead to deficiency, even if your diet is fairly balanced. And if you someone who sweats a lot, whether from exercise or working outdoors, you literally losing magnesium through your skin. So people who are active or work in hot environments may need extra magnesium to compensate. 7. High blood pressure. Magnesium acts like a natural muscle relaxer for your blood vessels. It helps them open up and improves circulation, which in turn lowers blood pressure. That's why people with mild hypertension often find that improving magnesium intake can make a noticeable difference in their readings, sometimes without needing to change medications. 8. Modern diet and soil depletion. Even if you're eating healthy, there's another hidden reason you might still be low in magnesium. Our food contains less of it than it used to. Modern farming has depleted the magnesium content in soil, meaning vegetables, grains, and even nuts grown today contain significantly less magnesium than they did 50 years ago. So, unless your diet consistently includes magnesium-rich foods like spinach, almonds, pumpkin seeds, and whole grains, there's a good chance you're not meeting your daily needs through food alone. How much magnesium should you take? For most adults, a daily dose of 100 to 200 milligrams of magnesium is safe and beneficial. If you have symptoms of deficiency, you may need a bit more, but don't exceed 350 milligrams per day from supplements unless guided by a healthcare professional like Dr. Mark Turner. Choosing the right type of magnesium. Not all magnesium supplements are equal. Some forms absorb well and are gentle on the stomach, while others can cause digestive issues. Magnesium glycinate and magnesium malate are excellent choices. They're easily absorbed and less likely to cause diarrhea. Magnesium oxide, on the other hand, is poorly absorbed and acts more like a laxative than a true supplement. Only use it if you specifically need help with constipation. Who should not take magnesium? Now, this is extremely important. There are certain people who should never take magnesium supplements without medical supervision. 1. People with kidney problems. Your kidneys filter excess magnesium from your body. If they're not functioning properly, magnesium can build up to toxic levels in your bloodstream, a condition called hypermagnesia. Early signs include nausea, vomiting, and diarrhea, but it can quickly progress to muscle weakness, dangerously low blood pressure, breathing problems, and irregular heartbeat. In severe cases, it can even stop your heart. Let me tell you about Margaret, a 72-year-old woman with mild kidney disease. She started taking magnesium for constipation, not realizing her kidneys couldn't clear it properly. Within 5 days, she felt nauseated and exhausted. Her daughter took her to the hospital, and blood tests showed dangerously high magnesium levels. She had to be hospitalized to flush it from her system. So, if you have any degree of kidney disease, do not take magnesium unless it's under direct supervision from a professional like Dr. Mark Turner. 2. People with low blood pressure. Magnesium naturally relaxes your blood vessels, which can lower blood pressure, a benefit for those with hypertension, but a danger for those whose blood pressure already runs low. Take the case of Robert, a 69-year-old retiree. His blood pressure was usually around 165ths on the lower side, but stable. After hearing that magnesium could help his muscle cramps, he decided to start taking it daily. On the 3rd day, as he stood up from breakfast, the room began spinning. He nearly fell. His wife checked his blood pressure. It had dropped to 85/55ths. When they called the clinic, Dr. Mark Turner immediately told him to stop taking magnesium. Within 2 days, his pressure returned to normal, and the dizzy spells stopped. So if your blood pressure is already low, magnesium supplements could make it drop too far, potentially causing fainting or falls, especially for older adults. 3. People with slow heart rate or heart rhythm disorders. If you have a naturally slow heartbeat or conditions like bradycardia or heart block, magnesium could worsen those issues. Magnesium slows down the electrical impulses that control your heartbeat. For most people, that's a calming effect. But for someone with existing rhythm problems, it can make the heart rate dangerously slow. Let me give you an example. Frank, 75 years old, had a resting heart rate of about 55 beats per minute, slow, but stable. Wanting better sleep, he began taking magnesium after reading about its calming benefits. Within a week, he started feeling weak and dizzy during his morning walks. At his next checkup, his doctor discovered his heart rate had dropped to just 42. Once he stopped magnesium, his pulse gradually returned to normal. That's why if you have any heart rhythm condition, always consult your doctor before taking magnesium supplements. 4. Medication interactions. Magnesium can interact with several common medications, sometimes with serious consequences. Let's look at the major ones. Antibiotics like tetracyclines and fluoroquinolones. Magnesium binds to these drugs in your stomach, preventing your body from absorbing them properly. Always separate magnesium and antibiotic doses by at least 2 hours. Example: Linda was taking antibiotics for a urinary tract infection. She didn't realize her morning magnesium supplement was interfering with the antibiotic. After a full course, her infection still hadn't cleared. Her pharmacist discovered the interaction: the magnesium was blocking absorption. Muscle relaxants. Because magnesium already relaxes muscles, combining it with prescription relaxants can dangerously lower both blood pressure and heart rate. Cardiac glycosides, like digoxin. These heart medications help control rhythm and strength of contraction. Rule 4. Watch your caffeine and alcohol. Both caffeine and alcohol increase magnesium loss through your kidneys. If you drink coffee every morning or enjoy a glass of wine at night, your magnesium needs might be higher. That doesn't mean you have to cut these out completely. Just be mindful that they increase your body's magnesium turnover. Rule 5. Don't take magnesium on an empty stomach. One of the biggest mistakes people make is taking magnesium first thing in the morning on an empty stomach. This often causes stomach cramps, diarrhea, or nausea. Instead, split your dose throughout the day and take it with meals. This improves absorption and minimizes side effects. How to start magnesium safely. Here's the step-by-step approach, recommended by Dr. Mark Turner. 1. Start low. Begin with about 100 mg daily, taken with dinner. 2. Go slow. After 1 week, if you tolerate it well, increase to 200 mg daily, divided between morning and evening. 3. Choose the right form. Magnesium glycinate or malate are best for absorption and gentleness. 4. Pair with food. Take magnesium with meals that contain healthy fats, like avocado, olive oil, or salmon, since fat helps absorption. 5. Avoid high-fiber meals. Fiber can interfere with how much magnesium you absorb. A word about lifestyle. Magnesium alone won't solve everything. It's not a magic bullet. It's part of a bigger health picture. If your diet is high in processed foods, sugar, and sodium, your body will continue losing magnesium no matter how much you supplement. Likewise, chronic stress and poor sleep can undo much of the benefit. So, for magnesium to truly work, combine it with a balanced diet, moderate exercise, and good hydration. Think of it as the foundation that helps every other aspect of your health function better. In summary, magnesium deficiency is extremely common, especially among older adults, people with diabetes, or those under chronic stress. The best forms to take are magnesium glycinate and magnesium malate. Avoid magnesium if you have kidney disease, very low blood pressure, or heart rhythm issues, unless your doctor approves. Pay attention to interactions with medications like antibiotics, muscle relaxants, and cardiac drugs, and always start low and slow. Have you ever experienced any of the signs of magnesium deficiency we talked about? Or maybe you're wondering if magnesium supplementation is right for you. Share your story in the comments. We love hearing your experiences. If this video helped you better understand magnesium and how to use it safely, please give it a thumbs up, share it with someone who might benefit, and subscribe to Health 365 Day for more science-based, easy-to-understand health insights from Dr. Mark Turner and our team. Remember, a healthy life doesn't happen by accident. It happens by choice, one small step at a time.